Hey everybody, Dr. Rainey. I got Gail in the office today. He's been a patient, but he came in today with some low back, some right hip pain. He's been doing some extra walking recently, and that's a common problem we see in the office now that it's really nice out. A lot of people going for walks in the evenings and in the mornings, and your low back can get tight. Just from the compressive nature of walking or jogging, you're going to have the compressive force sort of target that lower lumbar spine, your L4, your L5, the discs. It can sort of, like for Gail, it's radiating into his right hip a little bit. He's got some tightness in his right, like pelvic musculature. So we've been doing some soft tissue work on him. I wanted to just shoot a video so we can show you how we do that. And again, it's all about not just being pain-free, but maintaining as much functionality as you possibly can. And as life goes on, as wear and tear builds up, scar tissue builds up, you're going to lose that functionality. You may not have a lot of pain at the time. Pain may come and go, but if you wait before you address things, you're going to be left a lot worse off with a lot less mobility, a lot less functionality than you would have if you kept up with it. Gail's he's one of our best patients because he keeps up with this, so as things pop up, he comes in to get them treated before they turn into a bigger problem. So we've done a little bit already, but I'll just show you again. I've done this. We're just getting into his lumbar paraspinal musculature. He has this what's called a thoracic hyperkyphosis, meaning he has a almost sharp curve down. It's fine. It's part of his anatomy, but what it does is it creates a lot of stress build up right through here, because these paraspinal muscles are at almost too sharp of an angle coming down. So he has a lot of knots that build up here, especially one, like he said, he's been walking more. So we just get in with some lotion, just some massage lotion, just strip out those lumbar paraspinal muscles. That flushes out inflammation, breaks up adhesion. And he's also got some knots in his low back. And what I do a lot of times is, just to get like more of a general broad pressure, I'll use my forearm and just kind of get into his hip and his SI and just kind of use my body weight and lean into that. Again, it's not a real sharp pressure. He's not jumping off the table, but you're gonna feel where those pelvic musculatures are tight. You're gonna feel my pressure, and it's gonna provide a lot of relief when we're done. A lot of times, tight low back problems, low back in general, if you address the bigger pelvic musculature, some of the big lumbar spinal muscles, a lot of low back stuff clears up. So we always sort of, for everybody, we'll kind of get in. This is where his lumbar QL inserts into his ilium, where his piriformis, where his glute med insert, and we'll just hold a pressure. In fact, his problem's more on his right today, but I'll do both sides. Again, we were doing work, about 5 minutes of work before we started shooting, so we've done a lot of this already. We always check leg length to see if there's any pelvic rotation. His right leg is a little bit short. Relax your legs, Gail. So I do a lot of drop table work in the office. It's a table that sounds loud, but it's really for more patient comfort. He can stay neutral, stay flat, doesn't have to be twisted. So we can address a lot of low back problems without having to roll people on their side, which can create like almost a little bit of a torque on the disc. It could be problematic for some people. So if you're worried about getting adjusted with a twisting motion and you have low back pain, a drop table like this, which we have in all the rooms, would be good for you. Okay. All right, Gail, now here, I'm gonna go on your side facing me, Gail. Now, we can just do that for somebody, but I know I've seen him enough. We put him on his side too, and we'll sometimes get a little bit of movement here. Golfing and all, Gail? No plans?
No, not lately.
Also likes to golf. Again, we see a lot of golfers in the office. Take a deep breath in. Exhale. Good, other side. And we're gonna do the sinuses and neck after this. So this is going to be it for his low back after this one. Take a deep breath in. Exhale, yeah, good. And a little bit of movement there, that's perfect. On your back?
No, but not too bad.
Typically when he comes in to get adjusted, we'll with his neck adjustment, we'll do some sinus drainage. Do this for a lot of patients. A lot of fluid can build up in the sinuses with allergies, with the grass, and not so much pollen now this time of year, but the grass. So this, in combination with a neck adjustment, really does a good job of letting all that drain out, so you don't have all that fluid build up in your sinuses. Again, just a light pressure in the sinus cavities. Get some big ones here. Then we kind of hold this pressure, just so all that, any fluid buildup can move through. Got sinus cavities up here. All right, go on this temporalis muscle. We see a lot of jaw pain stuff in the office. We'll also do some sinus drainage with some jaw work. And then we'll adjust his neck. And that'll be it. Just relax your shoulders, Gail. Good. One more here. Just relax your shoulders again. There it is. I'll do his mid back too. Deep breath in, Gail. Exhale. Good. That's it. So that was his low back treatment. Again, doing some extra walking, so we wanted to keep his low back feeling good, and then sinuses and neck. So thanks for watching. Thanks, Gail.